I now hand over to Dr. Nitish.
Well, thank you, madam. I thank Dr. Netravati for chairing and moderating the panel discussion. It was indeed a wonderful discussion, and I thank all the panelists for the expert views on various aspects of multiple sclerosis and how to cope with these difficulties. I'm sure that this information will be very useful for the patients with multiple sclerosis, and majority of the queries has been answered during the discussion. I also would like to thank Professor Tissa for responding to the patient's queries by sharing the links to various resource materials that are useful for both patients and the clinicians. And I would also like to thank the patients for actively participating in the program. So I thank all of you. And now moving ahead, let us now listen to the patients' voices. We have pre-recorded videos of 4 patients who have shared their problems and difficulties as a result of the disease. So I request Dr. Rajiv to play the patient voices.
Let's now listen to them.
Hello everyone, I'm Akshaya, a patient of relapsing remitting multiple sclerosis for past 10 plus years. Talking about MS, the word may sound little complicated, but my life with MS is really not so. There is really nothing to be scared of. One good thing about MS is that you can easily camouflage with a healthy population, and it really never impacts the everyday walk of life. According to me, awareness about the flare-ups and early detection and treatment of the symptoms and self-care medications provided by the doctor. With all these, multiple sclerosis is something that can be handled and managed. From my personal experience, I really never felt like a patient who needed constant care and attention. There has been many days I really forgot I had multiple sclerosis. With the MS, I was able to score district first in my 12th board, and I'm having a successful work career. And I'm away from my home for past 8 plus years. So with MS, yeah, it's possible to have a normal way of life, and all it takes is a healthy food habits, regular exercise, meditation to be stress free. Nothing is impossible with MS if you have a strong willpower and a positive mind. I wish my fellow MS warriors a healthy, fruitful, happy life. Thank you for providing me this opportunity.
We have all listened to Miss Akshaya, which has given us an insight to the disorder. Let us hear from our next MS warrior about her experience with multiple sclerosis.
Hello, good morning everybody. This is D.N. Rajkumari, working presently as Assistant Commissioner of Central Excise, Service Tax, Customs, presently GST, as Assistant Commissioner of the department. I was diagnosed with MS in the year 1989, and from then it's been a long journey, and till 10 years, that is 2009, I was having progressive MS and was treated with steroids, namely methylprednisolone, Visolon tablets, and various other drugs. But fortunately or unfortunately, the progressive MS was stable after that, but the damage was already done to my system, and it has resulted in various disabilities. Like I have been paralyzed on my left side, totally unable to move my whole system, but it has further led to deterioration of all the organs. Namely, I had to undergo treatment for breast cancer twice, and not only that, I had kidney stones due to chemotherapy and radiation. After that, I was diagnosed with muscular weakness of the heart, and so right now I'm battling that out, and I'm also highly diabetic and hypertensive due to the drugs induced for MS. Now I'm managing with the present ailments with the sheer amount of willpower that I have with me. I have no physical or moral support except my job which has helped me to get through this crisis with all the medical facilities available to handle MS. My main request to every single person is to accept your ailment and to get in terms with it so that it will not affect your daily life. With all the odds, I'm still managing to have a decent and a day-to-day normal life, even though I'm wheelchair bound and I find it very difficult to access every place that I visit, either being office or market or anything, because I don't have any attendant and neither do I have any moral support from my family members. But of course, with the grace of God and with the available medications, I have continued to do my best and I will continue to do so. I want each one of you to have a perfect normal life without any complaints. I request each one of you to keep smiling and to have a great time of your life ahead. All the best.
That was indeed an empowering experience shared by Ms. Rajkumari. Next, we have Ms. Kavita with her experiences.
Respected Director of NIMHANS, respected doctors, and dear friends, I'm Kavita Jairam. I have been diagnosed with multiple sclerosis since the year 2005, and currently I walk with the help of a walker, and I'm at the SPMS stage of this condition. When I was diagnosed with multiple sclerosis in the year 2005, I consulted my family doctor, who was a general physician, and took my MRI reports along with me. And over the discussion, he told me that one day I would be completely bedridden, and that is how the condition would progress. This was very harsh for me. I just could not digest this, and I ran away from his clinic, thinking and knowing that I can definitely defy this condition, and if I have a strong mind, I can do anything in this with this, and believe that I will not be affected with multiple sclerosis. This is a wonderful thought, because I was a very healthy individual and I had a very good daily regimen of morning walk starting at 5 a.m. in the morning, and I would do yoga and also a bit of gymming. But multiple sclerosis did catch up with me inevitably. I kept my composure completely during the pandemic time. I had no other alternative. I just, took a deep dive into my work and completely studied my subject, and then now I have become an independent human resource freelance recruiter. I'm my own happy person. My goals are many. Miles to go before I sleep. One step at a time. I'm so in awe of Tyagaraja's Kriti, which says, Yendaro Mahanubhavalu, Andariki Na Vandanamulu. I reiterate my thanks to all. Namaste.
Now, let us listen to a beautiful song by Dr. Bevin showing his experiences with multiple sclerosis. I hope that this song brings a smile on your face.
Mr. Bevin, you've been diagnosed with multiple sclerosis. You're a musician, right?
Yes.
Since it's affected your hand, I don't think you'll be able to play music hereafter. I'm so sorry.
I messed up tonight, I lost another fight. I still mess up but I start again. I keep falling down, I keep from hitting the ground. I always get up now to see what's next. Birds don't just fly, they fall down and get up. Nobody loves without getting it wrong. I won't give up, no I won't give in till I reach the end and I start again. I won't leave, wanna try everything, I wanna try even though I could fail. I won't give up, no I won't give in till I reach the end and I start again. I won't leave, wanna try everything, I wanna try even though I could fail. Try everything, try everything, try everything. Looking for you come, you filled your heart with love. Baby, you've done enough, take a deep breath. Don't beat yourself up, don't need to run so fast. Sometimes we come last, we did our best. I won't give up, no I won't give in till I reach the end and I start again. I won't leave, wanna try everything, I wanna try even though I could fail. I won't give up, no I won't give in till I reach the end and I start again. I won't leave, wanna try everything, I wanna try even though I could fail. I'll keep on making those new mistakes. I'll keep on making them every day. Those new mistakes. Try everything, try everything, try everything, try everything.
I thank everyone for patiently listening out to our MS Warriors, hoping that these experiences have helped you to know more about multiple sclerosis and realize that hope is around the corner.
I thank all the people who have expressed their experiences and given such motivational messages. I just want to say that in my journey to understand MS, all of you have been perfect. Thank you. Over to you, Dr. Nitish.
Thank you, madam. I once again thank all the panelists for their expert views and the patients for sharing their experiences. And we now start the formal program with an invocation to Ma Saraswati. It is with her gracious blessings that we have all gathered here today to learn, teach, and grow. I now request Dr. Sneha, DM resident in neurology, for the invocation song.
Ya kundendu tusharhar धवला या शुभ्रवस्त्रान्विता या वीणा वरदण्डमण्डितकरा या श्वेत पद्मासना या ब्रह्माच्युत शंकर प्रभृति देवै सदा पूजिता सामातो सरस्वती भगवती विशेषजाड्याता.
Thank you, Dr. Sneha, for the invocation. It is my pleasure to invite Dr. Sanjeev Sinha, Professor and Head Department of Neurology at NIMHANS, for the today's program, and I would like to request him to give the welcome address. Over to you, sir.
Good afternoon, everyone. World Brain Day is celebrated on 22nd July every year under the aegis of World Federation of Neurology, with themes highlighting various brain disorders each year. This year, the theme is Stopping Multiple Sclerosis. So on this occasion, in the ongoing program, let me welcome all of you again. And on this again, I wish to welcome Professor Pratima Murthy, our beloved Director and Vice Chancellor, Senior Professor of Psychiatry.
Thank you very much.
Let me welcome Professor P.S. Shankanaran now, our own Registrar and Professor of Neurophysiology for this event. I take immense pleasure in welcoming Professor Pal, my senior in the department and immediate past president of Indian Academy of Neurology. It also gives an immense pleasure to welcome Dr. Vijayaratne, Chair of Public Awareness and Advocacy at WFN. A round of applause for those present here and online. I believe that our patients of MS who are mostly young suffer less and their quality of life improves with advances of care. This is one instance wherein caregiver burden is huge and we need to address that also. Today's program has been planned by Dr. Netravati and her team on behalf of Department of Neurology to emphasize various issues of the illness. We also are very happy to have active participation from the patients, especially the speakers. The Department of Neurology is well recognized world over for its straight of heart and holistic care to the needy patients. Also, and in those patient group, MS also comes. In this regard, for the first time in India, we have started a post-DM, postdoctoral fellowship in multiple sclerosis, which will enhance focused patient care, academics, and build manpower. I once again, on behalf of department, wish everyone and hope that such steps here and elsewhere will be helpful in improving the overall care to the MS. Thank you.
Thank you, sir, for the welcome address. And I now request Dr. Pramod Kumar Pal, Professor of Neurology, NIMHANS, to share his thoughts on World Brain Day. Over to you, sir.
Good afternoon. Thank you for giving me this opportunity to give my views. And it was indeed a very good program which was conducted by Dr. Netravati. Now, as medical professionals, we need to create increased public awareness and promote advocacy related to the health. We have earmarked over the last many years, several days of the year for specific neurological disorders such as World Stroke Day, World Parkinson's Day, Epilepsy Day, etc. On these days, the professional organizations like, say, epilepsy or Parkinson's disease, etc., collaborate with the national other organizations, societies, local patient and caregiver societies, even with sometimes with WHO, with the health ministries, etc., to educate the public about the neurological disorders and how to detect the early symptoms and what treatment is available and how much we can do for the patients and for the caregivers. Though the World Federation of Neurology was established way back on July 22nd, 1957, it almost took half a century to formally start these World Brain Days, which are nowadays, state of the art, days for celebrating and for taking forward the cause for different type of neurological disorders. This Public Awareness and Advocacy Committee of the WFN suggested that 22nd July 2014 should be started and should be celebrated as the World Brain Day. And this proposal was actually formally announced in the World Congress of Neurology and the Council of Delegates meeting on 22nd of September 2013, that is the previous year. So the World Federation of Neurology started with the first World Brain Day, and it was on 22nd of July 2014. And the main objective were twofold: to increase the public awareness of that particular disorder, which will be the theme of that particular year, and to promote advocacy related to brain health. So the first World Brain Day was in 2014, as I told you, and that was a very philosophical topic, Our Brain, Our Future. And actually this topic is going on every year. It will be the same, whether we delineate one particular disease or not. Our brain and our future always will be there. Then subsequently in 2015, epilepsy is more than seizures. 2016 was brain health and aging population. And this is still, very relevant, though whatever actually has been in the last few years is very relevant. In 2017, the most important, preventable disorder which is causing so much of mortality is stroke. So stroke is a brain attack, prevent it and treat it was the theme. In 2018, it changed little stance, WFN, and brought in the pollution and the epidemiological factors which causes neurological problem. So that their theme was clean air for healthy brain. And 2019, everyone's headache. So it was migraine, the painful truth was the theme of 2019. Last year was Move Together to End Parkinson's Disease. And this year, it is very aptly, the WFN has made it for the multiple sclerosis, and the theme is Stop Multiple Sclerosis. So multiple sclerosis, about 20 years back, about 30 years back when we were students, we never knew that multiple sclerosis is a real problem in India. And we thought it is mainly of the advanced, the highest societies and the temperate climates, etc. But gradually we became aware. It is not that it was not there. You become aware. And this awareness is very important, that there are so many young people are getting daily affected. In fact, WFN estimates that about every 5 minutes, one person is getting a diagnosis of multiple sclerosis. And this is a diagnosis, and this is a disease of the young people. It is young people, and the disability is tremendous. So we need to prevent this. We may not be able to prevent the first attack, but after a first attack, after a second attack, already the brain gets damaged more and more, and the disability can be prevented. So we have now various good drugs which can prevent after the first attack. So definitely, the estimate is about the 2.8 million people are living with multiple sclerosis in the world. And I'm sure that this awareness program which has been done today, and I'm sure that this will be carried on for the next 1 year, at least officially, this awareness to stop or to prevent the second attacks of multiple sclerosis will be very useful, and definitely for the patients as well as the caregivers, as well as for the health administrators, to prevent and to formulate strategies. And also one important thing should be done to reduce the cost of the medicines which are required to prevent the second attacks of multiple sclerosis. With this, I would like to again thank Dr. Netravati and the team and our director, everyone, for conducting this program. I am sure that in the future this will go on. It will not be only the end of today that the program will stop. It will go on for all the years to come. Thank you.
Thank you very much, sir. It gives me immense pleasure to welcome Dr. Tissa Vijayratne, who will be joining us online from Australia. Dr. Tissa is the professor and chair of the Department of Neurology and Stroke at Western Health, Melbourne, Australia. He is also the chair World Brain Day 2021 and chair of the World Federation of Neurology Public Awareness and Advocacy Committee. We are delighted to have you, sir, on this occasion, and thank you for joining. I would like to request you to kindly speak a few words on this occasion.
Hopefully you all can see my slides. First of all, my sincere gratitude to my very good friend and colleague, Pramod, or Professor Pramod Pal, for connecting me with Netra a few weeks back when I texted him saying that I was wanting to interview a couple of MS experts in India. I was doing certain work with Professor Netravati beforehand as part of the global COVID-19 coalition. So we knew each other's, but that connection was useful. And that is part of the process of me visiting your majestic, beautiful country and your wonderful institute. I'm aware that you are one of the premier institutes in India. I had the good fortune of interviewing Professor Satish Chandra a few years back. It is available in World Federation Neurology YouTube channel. And I keep going back to this video every time when I'm visiting a different country virtually to tell them how they make changes happen, as NIMHANS is the epitome of how you do things in a meaningful way to the world. I think the first part of this symposium is such a telling example, the sheer brilliance that you can bring to this world. The way that you conducted the session, the way that you integrated different craft groups, the using everyone to bring the very best of their brains and then preserving our very important patients' brains as best as we can. Not only that, and then encouraging those patients to give us the inspiration at its very best by combining the visual, the art, the music, the lyrics, the language. It's beyond the description. I have been tweeting behind the connecting your message globally as I tagged them to World Federation Neurology and Multiple Sclerosis International Federation. We basically represent, well, basically almost all part of the world. So thank you. So these are the some of the things. You already know who I am, but I'm using this slide to tell you two things. I'm in preliminary discussion with Netra to put together a collaborative large grant that would come from Australian government if we are successful. I'm waiting for my university to the support me on that. Each university would support only 2 applications. And if we are successful, we would be partnering with NIMHANS to address a very key important issue that would establish a really decent marriage between NIMHANS, Western Health, where I work, Monash Health. Those are the 2 premier universities in Australia. And that would help us to unravel a lot of mysteries in that field. That's sort of the first message that I wanted to remind you, as I'm aware that distinguished leadership of NIMHANS is watching as I speak. Second thing that I wanted to remind you is most of you are probably aware that the Inspiring People in Neurology session that run by Indian Academy of Neurology in collaboration with World Federation Neurology is on coming Saturday. I will be chairing that meeting to talk about late Professor Jim Lance. You can learn more about Jim on that day, so please join in. And the second invitation is I am running the 4th the Lance Godsby Symposium in few weeks' time, and I would be very keen to have a combined virtual session in collaboration with NIMHANS, Monash University, and University of Melbourne. I'll send the necessary invitations in due course, so please mark your diary and join us to establish a strong partnership. Third thing is, you can see that I'm the editor-in-chief for Neurology International MDPI. I'm running a special collection on the advocacy in neurology. When I say advocacy in neurology, brain health belongs to everyone. So we encourage all partners that I heard throughout last 1.5 hours to submit your brilliant advocacy work, and we are very keen to publish them in our collection with the impact factor just above 4. So that's all that I was wanting to share with this slide. You can forget the rest of the other things. Professor Pramod Pal gave you a very nice introduction of World Brain Day. I encourage you to just Google the Nature and my surname. You would then get this open source document from Nature. It's a very quick 5 minutes read. In 2 paragraphs, you would know how the World Brain Day was born. If you wanted to be a super smart expert on World Brain Day campaign, you are encouraged to read the rest of the other editorials and other things that I penned from Melbourne in Lancet, Multiple Sclerosis, Canadian Journal of Neurological Sciences, and Neurology International, which will publish very soon also. Rest of the other things are published. So that would give you further insight onto World Brain Day. So rest of my talk is going to be basically the couple of pictures telling you the story. So this whole thing started when I attended the second World Congress of Neurology of mine as a second year board certified neurologist with just 1 publication under my belt to a session on the neurology and neurology training in developing world. So a small speech that I gave from the back row basically convinced Professor Vladimir Hachinsky to pull me out and put me to the education committee of WFN, asking and challenging me to do what I propose him to do through my networks and my labor. Rest is history. And then I became part of the WFN variety of committees. Then in 2008, as part of Palatochi advocacy program, I met Mohammed Wasi from Pakistan. I met Walter Struhal from Austria, Wolfgang Grisol from Austria. This is a photo that we took from one of the advocacy workshops that I was asked to chair with then President Raad Shakir, who doesn't need introduction to you. So we were brewing the idea of having a particular day to talk about brain, especially these two culprits on the left-hand side. We felt that we need to have some way of talking about brain so that we could address the lack of resources, lack of awareness, lack of training positions, lack of educational opportunities, certainly in various parts of Asia and various parts of Africa and some parts of Latin America, to say the least. So this was happening and brewing behind our heads and various emails for a few years. And then I think in the 2013, while we were sipping a cup of coffee with Professor Hachinsky, who happened to be sitting with us on a couple of advocacy workshops, we felt that whether he would be willing to support the motion of a concept of a World Brain Day, and we made the proposal like a sort of a casual chat. Why don't we select the birthday of World Federation Neurology, which is 22nd of July 1957? We could run a campaign initially on talking about brain health in particular. In fact, most of the stuff that you see in First World Brain Day, which is available in our archives, were written on my desk. When I say my desk, I was heading up the stroke service at Western Health, where I still work. I didn't have an office space, and I was basically signing off documents and drafting stroke guidelines on the back of a dustbin. So just because you live in Australia, you don't get things in silver spoon. So I saw rest of the other committee members writing really high-tech, complicated medical jargon on our brain, our health. I was reluctant to change them just out of respect. But then the 12 hours before we were due to finalize things, I felt that I should shy away from my shyness and change it completely, which is what I did. So I basically changed it exactly as you see in First World Brain Day campaign. We're talking about neurons, talking about we have 80 billion neurons, talking about how it is related to walking around planet Earth a few times in a row, this and that. To my surprise, rest of the other committee members endorsed that, and that was that. And First World Brain Day was a resounding success. The whole world embraced it. So then I'm not going to bore you with all these things. The Professor Pal already went through the topics. So as we grew as the concept, as we hit the mark, 50 million, 60 million mark, I think it was around sort of 2018, we felt that we have to lengthen the campaign. Rather than concentrating on a single day, we basically start the process early in the year and then build it up to the maximum on 22nd of July and then continue for a few more months so that the whole world can bring along. Our ambitious aim was to pass 1 billion mark eventually before we retire, so that billion people talk about the importance of brain and brain health. And we decided that we would partner with a particular craft group for different international organizations. And hence the theme changed. As you can see from the concepts, we started to concentrate on a particular disease. We moved from different themes and different organizations. At the same time, World Federation Neurology was enhancing its collaboration. As you can see, we now have a thing called Global Neurology Alliance, where everything related to brain connected together in advocacy. We have a brain health unit at World Federation Neurology, which is chaired by your very own Dr. Tarun Dua, whom I interviewed recently, available through WFN website. So then since 2019 onwards, we would have a peak webinar on 22nd July, and then the webinar would be available for the rest of the campaign. And then we would rerun live Q&A sessions at least 2 times in the coming months. So this, the activity that you are doing is really timely, and I strongly encourage you to keep doing similar things over next couple of months where possible. So this is, although we celebrate World Brain Day on 22nd of July, the campaign actually alive and well for few months. This year, I'm confident that we would pass 100 million mark. I don't know the exact numbers yet, but I do know that the most of our website almost crashed with 4,000, 5,000 times increase in web traffic. I wrote a segment for our own newsletter called Pursuit on MS and Melbourne University web traffic rose from about 5,000 times within 2 days. It's unbelievable the way that the world has embraced the importance of wealth. I'm going to share what's the secret behind that. We kept things very simple, as you can see. And we are very inclusive. Everyone else in these photos, excluding myself and Surat from Thailand, were either first-year medical students or second-year medical student. I am very keen to get all healthcare students to be interested in brain health. There are millions of super keen, very bright young brains out there that we must get on board. So this year, our main theme is I want every one of these students to get onto their device and post something on their Facebook. I support World Brain Day, hashtag World Brain Day, hashtag Stop Multiple Sclerosis, hashtag brain health is important, hashtag there's no health without brain health, we are in this together, things like that. So we can basically put the brain where it should be, which is really necessary. And the other thing is, on left-hand side, you are seeing my first, my anatomy teacher, who is no longer alive with us. She taught me what human brain is when I didn't have a clue what a neuron is, as I was born in fairly rural Sri Lanka, where you wouldn't hear the word neuron. And I still kept in touch with her until her last days. On the most right corner, you see my first surgery teacher. He's still alive. He's a nightmare to work with, but a brilliant teacher. And I learned heaps of things. And if not for some of my brilliant neurology mentors who really brainwashed me as a second or third year medical student, I should have become a vascular surgeon just because of him. They are amazing human beings. So we kept trainers and teachers on board. And on the right-hand side, you would see, I think this is when we had the Vienna meeting. This is again, Surat, one of my culprit partners in social media team in WFN from Thailand. And you see young residents from European countries. And so we kept targeting youngsters because they are our future. And again, we kept it very inclusive, the men, women from every spectrum of the board. Everybody is representing a different country in these two pictures from different age groups, as you can see. So we were very keen to make this a global, all-inclusive issue because it is very important. And the other thing is facing the challenges as you brilliantly showcase how it is done. So I don't need to brainwash you on this. And we were very keen to get patients involved. This is first ever Australian national walk to combat Australia's leading cause of disability, migraine, affecting close to 6 million people, when we took people to street peacefully marching and raising awareness, and every single media channel in Australia for the first time ever talking on a medical topic and talking on migraine. So as you can see, I have virtually visited almost all countries in the world since the COVID-19 pandemic came on board, and we have been relentless, and we will not stop until we make sure that the whole planet is promoting brain health and supporting brain health and preserving brain health, because without our brains, we are absolutely nothing. Again, my sincere gratitude and absolute honor to visit your wonderful, majestic institution, which I showcase as the epitome of example globally every time when I talk on advocacy, and I direct people repeatedly to go and watch the video interview that I did with Professor Satish Chandra, how you build NIMHANS almost out of nothing, and then telling people that if they could do in majestic India, you could do it too. Again, my sincere gratitude, and I look forward to engaging with your institution and many researchers and making the connections, and hopefully build a much better world with much better brains, as those MS warriors told us that there's nothing that is impossible for great human beings. And you are talking to me from a land where some of the greatest human souls born, two of the greatest human beings that I eternally respect, the great Lord Buddha and the great Mahatma Gandhi, was born in this land. I think they belong to the whole world, and it is an immeasurable, unimaginable honor to be in your land, albeit virtually. I have visited your beautiful country multiple times physically, and I look forward to visit your institution, hopefully with successful grants that we are working on to make the connections between youngsters and elders in the same way, so that we can build a better world together. Thank you very much again, and happy to take any questions on anything that I mentioned.
Thank you, Professor Tissa, for taking us through a wonderful historical journey behind the formation of World Brain Day and the various themes covered so far. It is really inspirational for most of us. Thank you once again, Professor Tissa, sir. I now request Dr. Netravati to initiate the release of IC material.
On this occasion of World Brain Day, we from the Department of Neurology have collaborated with the Department of Psychiatric Social Work and Mental Health Education and come forth with a patient education brochure on multiple sclerosis and a video that has messages to all the MS warriors, from the director, faculties from the Department of Neurology, and other people who take care of people with MS, from the Department of Psychiatry, Psychiatric Social Work, Clinical Psychology, Radiology, Rehabilitation, and Integrative Medicine. This will be released after the program today. We shall have a glimpse of that video now after the release of the brochure. For this, I request the director and the other dignitaries to release the brochure and video. So the formal video will be released after this program. Our director has always been a great force and a staunch supporter for all our endeavors. I welcome Madam to render the presidential address.
Thank you very much, Dr. Mitra. It is actually music to the ears and a great inspiration to be here this afternoon, listening to all the developments in terms of bringing up awareness about various neurological disorders. Professor Sanjeev Sana, Professor Shankar Narayan Rao, Professor Pramod Pal, Professor Netra, all my colleague faculty, and staff from the different departments who have been involved with today's program. It's certain things come to my mind immediately. And one thing is the congratulations to Dr. Tissa Vijayaratne for actually being involved with the World Federation of Neurology and highlighting in the last few years so many important aspects of the brain and bringing about awareness of a variety of brain disorders. And I think understanding these disorders, trying to see what's happening and how to prevent them as well as how to manage them is really a very important challenge ahead of us. Professor Pramod Pal also outlined the various initiatives that have been taken. And this year being the Stop Multiple Sclerosis Day that is being commemorated. All of us know how serious a problem multiple sclerosis is. The World Health Organization estimates a prevalence of about 5 to 20 per lakh. In India, Dr. Pal mentioned that we didn't think too much about this disorder a few decades back, but we now know that there is perhaps a prevalence of about 1.33 per 1 lakh population. When I was listening to the various MS warriors, my own thoughts went back to possibly a couple of decades ago when I saw this very young lady who had first been seen by my colleague in child psychiatry. She was like on the cusp between teenage and her early 20s. And she had come to him with various anxiety and obsessional symptoms. And of course, she had some psychotherapy. And then after a few days, she developed some very bizarre psychotic symptoms and went into what we call a catatonic state. We treated her with antipsychotic medication, and she actually developed very severe side effects to these antipsychotic medications. And then she had to receive ECTs, with which she improved. But she never really recovered to her pre-morbid state. A little later, there was some gradual improvement. And I remember at that point in time, we did a baseline imaging, which didn't really show anything very definitive. A couple of years later, when she joined law school, she developed ophthalmic symptoms. And then another MRI that was done revealed classical symptoms of MS. She had a lot of waxing and waning of her symptoms. But subsequently, she went on to become a lawyer and pursued her profession with all the kind of challenges that came with the disorder. So while we recognize that this can be an extremely debilitating disorder, it's a mysterious disorder. We know that there is immunological, genetic, environmental, infectious, so many different things can contribute to the disorder. But at the end of the day, we know that it presents in protean ways, and it has not a very predictive course of the illness, which brings with it a lot of challenges. And that's where listening to the MS warriors today was so exhilarating in some ways. And I want to specifically respond to some of the things that they said. It was Akshaya who said, don't be scared. So I think that is very true of any disorder that one might be afflicted with. Not to be scared, but to arm oneself with information about what the disorder is, what can happen, what are the precautions that you must take, and what you might need to anticipate, but also to live with this condition. Being aware, knowing what medications to take and taking it properly, knowing that it can be managed, and thinking about life and a good future, I think, are the mantras that Akshaya mentioned are very important for people to follow. And then listening to Ms. Rajkumari about how, despite all her challenges, including the lack of adequate support, that she has managed against all odds to do what she is doing today, I think, an assistant commissioner in taxes. I think, madam, you're an inspiration to so many people that despite all odds, you can actually make a good, successful career ahead. We also listened to Ms. Jairam, and I think your recitation, your powerful words of how even when you were feeling helpless, you managed to get up against all odds, and you're actually, now having a human resource, a training company, again, is such a delight to actually listen to. The grace and the composure with which all of you have shown that you can come out of this, starting with one step and understanding that you will be able to go miles ahead of you, are very important. And finally, I think it was Vidish who sang a very, very nice song and actually showed that despite all challenges, you can overcome. So I hope that one day we can overcome multiple sclerosis, but until that day, we need to be able to know how to manage multiple sclerosis. And that is why the multidisciplinary team that Dr. Netra has gotten together is really something that in some ways is a celebration of what NIMHANS stands for. That although the entry might be in terms of trying to address a neurological disorder, knowing that a condition like this has psychological sequelae, psychiatric sequelae, difficulties in terms of requiring rehabilitation, requiring long-term. Very important that all departments come together. So I'm very happy to see the mental health education department talking about awareness, the psychology department perhaps looking at the rehabilitative aspects, the cognitive aspects of the disorder, neurorehabilitation, looking at various interventions that you can put in, the Department of Psychiatric Social Work to look at the long-term issues, psychiatry, because we know that there can be severe psychiatric sequelae. I hope I've not left out any other departments. Ayurveda and integrated medicine, because I think, and again, various people have spoken about how you can actually integrate that. And finally, of course, the Department of Neurology. We saw all the various colleagues and faculty in the Department of Neurology. I wanted to congratulate also Dr. Sanjeev Sinha and the entire team, and mention that having a postdoctoral fellowship now in CNS demyelinating disorders that include MS is a very, very important step. Dr. Tissa, you also mentioned the importance of taking young people along, and I think this is an example of how newer trainees can get interested in the disorder, and hopefully they will be the ambassadors to tell people that even in debilitating disorders like multiple sclerosis, there are ways forward. Of course, while we need to understand the disorder better, we're also committed to ensuring that people with this problem are provided better awareness, provided better treatment modalities. We improve the knowledge and diagnostic algorithms for this disorder, and we disseminate knowledge as has been done through the release of the brochures and the videos. So I'm end on a hopeful note that while we commemorate this today as stopping multiple sclerosis, hopefully in the years to come, we will be successful in stopping it. Till then, we fight it. Thank you very much.
Thank you, madam, for that inspirational and encouraging words. The administrative efforts is invaluable in all the work we do. And I request the registrar to deliver the vote of thanks.
So good afternoon to all of you. And today is the most important day when we talk about the World Brain Day. Most importantly, a neurological condition. There are two components. One is to prevent, another one is stopping the multiple sclerosis. The theme of the World Federation of Neurology and spanning for the entire year, just to bring an awareness and also to have various developments in terms of the treatment, management of patient, and subsequently bringing the awareness to the public, identifying the disease process at the early, and also the supportive efforts which we have to do. I'm very happy that today our beloved director, Dr. Pratima Murthy, who is presiding over this function and also guiding the entire team of this program in terms of having kind of a collaborative program and a very comprehensive approach to understand the multiple sclerosis at multiple levels of neural organization, both at the neurological head, at the behavioral head, and also at the cognitive head. And most importantly, integrating everything with integrative medicine. And also the message and the journey of World Federation of Neurology in terms of evolving into the 22nd July is the birthday of the WFN, has translated and evolved as a World Brain Day celebrations every year with a different theme. And Dr. Trisa, so his contribution in terms of evaluating the themes and also to be chair for the awareness and also advisory committees. So we thank him for participating in this program. It's a collaborative program between NIMHANS and also WFN. The support which we received from the WFN in various activities of the neurological societies, including Indian Academy of Neurology activities at NIMHANS and also overall neurological conditions with the support of WFN has to be appreciated. Thank you very much for taking part in this, Dr. Tisa. And Dr. Pramod Paul is a well-known neurologist. He was the immediate past president of Indian Academy of Neurology. And he brought out what is the importance of the World Brain Day. And also, more importantly, the theme of this year's World Brain Day is on multiple sclerosis. He himself works on the developmental disorders and also the movement disorders. So his contribution is appreciated. It's always a teamwork which is led by the HOD of Neurology, Dr. Sanjeev Sinha, who gave an introduction and also spearheaded the entire team of neurology in collaboration with the psychiatric social work and also the mental health the mental health department, bringing out the resource materials. They are extremely important. Whatever we discuss in these meetings, it has to go out of the meeting hall. That is always happens when it reaches to the community. The resource materials, whatever is evolved, they are the workforce where it reaches into the community. So in this direction, collaboratively working with the PSW and also the mental health department is appreciated. More importantly, just to bring a comprehensive understanding. And as our director said, the MS is always a comprehensive team is required to understand the disease and also to treat the disease and to provide and evolve various supportive measures and also to take care of their lifestyles. So all of that put together. So it's a wonderful the team of resource people who participated in the panel discussion. I thank each one of them, their contribution for today's program and also in their own respective areas. And on behalf of the organizing committee, I take this opportunity to thank them. But most importantly, the convener or the organizing secretary, who is always, works beyond in terms of making into this program, that is Dr. Netra. And the entire team of neurology, the residents, all of them, they have taken part in this program. What is very appreciable is that the MS warriors, the way they have overcome with the support of neurologists and also the team of the multidisciplinary team of MS, and they succeeded. And they have overcome to most part of the MS, and they are leading their life, and they are the wonderful examples how the lifestyle and also the neurorehabilitation and various kinds of the modalities of treatment can be helpful for them. So I take this opportunity to thank the MS warriors and all the patients who have contributed for this knowledge, and all the neurologists and the entire team of neurologists, psychiatrists. You have the behavioral scientists and also the laboratory services. Each one of them, including the radiology, who contribute significantly in terms of developing diagnostic tools and many of those components. So on behalf of the Institute, and it's a pleasure to thank the entire team of organizing, team of the World Brain Day, specifically the organizing secretary, Dr. Netra, and the wonderful team of young faculty, and also the colleagues. We made this program very successful, and this program is only a beginning. And this awareness program and also educating the community, and it should move way forward. So on this occasion, on behalf of each one of you, I take this opportunity to thank Trisa, Dr. Pramod Paul, and all the colleagues who have taken part in this program by online mode. And I thank each one of you. And so we'll close this program. Thank you.
Thank you, sir. Now we formally conclude the program. We shall share the video of the messages which has been given by the various faculty.